Hello and welcome to Chapter 6, the Endocrine System. So we have covered the nervous system and how it controls and regulates the body's responses to events and returns the body to homeostasis. This is not the only body system to do so, however. The endocrine system also has a major role in bringing your body back to homeostasis. Now, the endocrine system deals mostly in hormones, and their major physical form processes are reproduction, creating more offspring, growth, growing from a baby to an adult, and development, with systems becoming more complex. Hormonal pathological conditions affect function just as much as the nervous system does, and it can also affect form. You get a pathology with your endocrine system for reproduction. It might not be possible for you to have children. You could have stunted growth, stunted development. Now, the endocrine system uses a negative feedback system to regulate physiological functions. Now remember, a negative feedback system provides a stimulus to decrease a function. Negative feedback regulates the secretion of almost every hormone in your body. The key functions of these hormones are regulation of metabolic functions, regulation of chemical reactions, and regulation of the transport of substances through all of your cell membranes. Now remember, when we talked about the nervous system, we learned that the chemicals found in the synapse is called a neurotransmitter. When the same chemical is found in the bloodstream or tissue, it is a hormone. Neurotransmitters are hormones. They are a neurotransmitter when they are conveying information in a synapse in the nervous system, and when they are in the bloodstream or in the body tissues, it is called a hormone, whether it is the same chemical or not. Neurotransmitters act on adjacent cells next to them, where hormones travel long distances in the body before they reach their actual target cells. The one big difference to remember between the endocrine system and the nervous system control are the speed and duration of effect. The nervous system is fast acting with a short duration of effect. Just like an electrical shock, boom, it's there and done. The endocrine system is slow acting with a long duration of effect. You're pouring water on concrete and the water sits there and takes a long time to evaporate. One is an electrical shock. The other, you are secreting a bunch of hormone and you are waiting for that hormone to be absorbed and take effect over a period of time. This offers a little bit of a balance of control, with the nervous system responding quickly when needed and the endocrine system taking over to either sustain a response or to dial back the level of response as needed. Now, remember, we've discussed feedback loops as a process to maintain homeostasis. And again, I'm going to reiterate, we are learning that negative feedback loops regulate the secretion of almost every hormone. The term negative feedback refers to the feedback that reverses the original stimulus. It stabilizes the physiological function and helps us maintain our constant internal environment. So imagine you're turning on the bathtub water and you want warm water, and you turn on the hot tap. And the hot tap initially comes out cold, so you leave it on hot because you want it to warm up, right? You're looking for warm water. But as that water comes up from the water heater through the pipe, suddenly it becomes scalding hot. Now you also turn on the cold water, which brings that super hot temperature back down closer to warm water. That is an example of something that would be a negative feedback loop when it's in the body. When an organ secretes a hormone and then your body dials back to bring it back in, such as insulin, responding to blood sugar in the body. Once that sugar is consumed, that insulin dials back. We no longer need as much in the body. Before we dive deep into all of the various organs and glands of the endocrine system, I want to talk about the difference between endocrine and exocrine glands. The endocrine glands are ductless glands that secrete hormones directly into the bloodstream or diffuse into nearby tissues. In contrast, exocrine glands, or glands with ducts, such as the salivary and sweat glands, secrete their products directly into ducts that open to specific areas. The endocrine glands are ductless. They have a tube going around. There's no duct attached to the gland itself to directly push out any type of fluid. They have internal secretions known as hormones that go directly into the circulating blood surrounding them to reach the receptor cells in the various organs they are trying to reach. Endocrine glands are extremely complex, and the most important ones are the pituitary, the thyroid, the parathyroid, the adrenals, and sex glands. Now, exocrine glands have ducts. They are attached to a tube that is a duct. They secrete products normally called enzymes, as well as mucus and other substances. These secretions are released to the outer surface of the body or to internal organs through a duct. The glands themselves are usually fairly simple, and examples of these would be the salivary glands, which secrete saliva into your mouth. When you pull your tongue back, you can actually gleek and see them in action. Gleeking is when you pull your tongue back and you activate your salivary glands and shoot streams of saliva outward from them. You're welcome for that information. That will not be on your MBLEX. The liver is also an exocrine gland. The pancreas, sweat glands. You get sweat secretions onto your outer skin. These are all examples of exocrine glands. The book does a little more continued education with yin and yang. This is an image from your book, with the image showing yang for the male and yin, obviously, for the female. And it gives you a table of vibrations, musical notes, and colors associated with various glands and nerves and the system and elements that it is related to. All right, so the brain is the nervous system. The pineal gland is the endocrine system. The system that it associates with is the nervous system, and the element is your inner light. You can read through these. There's the carotid plexus with the pituitary gland, standing for the endocrine system and inner sound. There's the cervical plexus that relates to the thyroid gland, responsible for growth and metabolism, which the thyroid does. The cardiac plexus and the thymus gland, responsible for respiration, circulation, the immune system. The solar plexus relates to the pancreas, which is a gland, muscles, digestive system, and onward and forward with this. It is on page 187 in your book if you would like to look at it in the book in a little bit more detail. There's not much information in here for endocrine glands and ancient healing traditions. They do talk about the chakra system with anatomical correlations to the ANS plexus and functional aspects interrelated with the endocrine gland functions. But this is an absolutely fascinating topic. It is not deeply covered on your MBLEX, but if you are interested in this subject itself, please let me know, and I will absolutely get you some good materials on the endocrine system. So, what are hormones? Like, how do they really work? Hormones are secreted from endocrine glands and tissues. Each hormone causes a response in a specific target organ or group of cells, rather than acting on the entire body as a whole. Now remember, exocrine hormones are secreted through a duct into the blood, usually called enzymes, and they affect a distant organ or tissue. Endocrine hormones are secreted within the tissue itself and enter the bloodstream through the capillaries. Now, your book focuses on 3 major types of hormones. I have 4 up here for you to see on this chart. The amines, which your book states are simple molecules, but they are actually amino acids that have modified groups within them. And here you see an example of norepinephrine. There are proteins and peptides, which your book groups together, which are chains of amino acids. Here in the chart, you can see that a peptide hormone is a short chain of linked amino acids, such as oxytocin, and protein hormones are long, very often complex chains of linked amino acids. In this case, they are referencing human growth hormone. Fun fact about human growth hormone, it's responsible for a ton of the repair in your body. It's not just for growing and developing, it is for repairing body tissues. It's what is responsible for building big muscles when you tear them down at the gym, but it only activates when you're sleeping. If you're doing a bunch of work at the gym thinking you're going to get huge gains, but you don't bother to get decent sleep at night, you're shooting yourself in the foot because you're not allowing your human growth hormone to actually activate once you hit that REM stage. The last one, off of my tangent here, are steroids, which are derived from the lipid cholesterol. Here you see some sex hormones, testosterone, and progesterone. This image is depicting what we call a lock and key model of biochemical reactions. You can see the blood capillary there with various hormones coming out of it. And up at the top and the bottom, you see these green non-target cells. And if you look at their receptacles on the outside, you can see that the little hormones that are shaped like loaves of bread just won't fit onto there. But the target cells have receptor sites that will absolutely accept those, like a little toaster slot. Those are the target cells. And this is a simplified look at how the body doesn't affect organs that it doesn't want to. It sends out specifically shaped or chemically identified hormones that can only attach to the target receptacles on the cells or organs that it wants to send the hormone to cause a change. This chart is a simplified look at your glands, the hormone that it secretes, the target organ, and the general function within the body, such as the pineal gland produces melatonin. It does affect several organs, and it helps you recognize your circadian rhythm and your night-day sleep cycle. It acts on your biological clock in many ways. The pituitary gland produces growth hormone, oxytocin, prolactin, antidiuretic hormone. It also produces follicle-stimulating hormone and luteinizing hormone, which are glycoproteins. Now, the target organs are the ovaries, the kidneys, the uterus, breast tissue. These all control like the menstrual cycle, growth and division, birth contractions. Prolactin is for milk production. These are all mostly feminine, reproductive, or development hormones. The thyroid gland produces thyroxine. The target organ is the liver, and we are telling it at what rate to metabolize. When you take pathology, you will learn about hypo and hyperthyroidism. We will also touch on it in this chapter. That is the under or overproduction of secretions of your thyroid and parathyroid glands. That can cause your metabolism to be way too slow or way too fast. Your adrenal glands produce adrenaline or cortisol. These do affect multiple systems within the body. And your adrenaline kicks you into fight or flight. And cortisol is your stress hormone or anti-stress hormone. It is dumped into your system quite frequently when you are overstressed. There are pathologies related to these two. One with cortisol would be Cushing's disease, which we will talk about as well. The pancreas produces insulin and glucagon. It will target the liver, and this helps with your blood sugar levels. Diabetics, absolutely, is the number one pathology you will think of when talking about the pancreas and insulin and glucagon. Your ovaries produce estrogen and progesterone, which do affect the uterus. It affects the menstrual cycle. And the testes are responsible for testosterone, which affects many, many organs within the male body and has to do with male characteristics, bone thickening, hair growth, sweat gland development. There are changes all throughout the body with these. All right, this dangling pair up here is your pituitary gland. And we have your anterior pituitary shown in the tan color there on the left, and the posterior pituitary shown there in the lighter color on the right. And let's talk about what the anterior and posterior pituitary gland send out. The first one is somatotropin, growth hormone, here symbolized by GH. It promotes tissue growth. The major target organs are bones and muscles. And in the adult, the responsive growth hormone is the repair and rebuilding of tissues, what I was just talking about. You won't get your gains unless you also get your sleep, because growth hormone follows a circadian cycle, with the highest levels occurring during evening sleep, primarily delta wave sleep. It releases stored fat and raises blood glucose concentrations to provide you with energy. It's also triggered for release during exercise and periods of hurt, tension, and stress. As we age, the total amount of growth hormone secreted starts to decline. Now, the next one from the anterior pituitary there is symbolized by the TSH going to the thyroid and thyroid hormones. TSH stands for thyroid stimulating hormone. This is a tropic hormone that promotes and maintains the growth and development of the thyroid gland and controls the release of thyroid hormones in a negative feedback system. Production of TSH often increases in response to cold temperatures. TSH is a glycoprotein. It is water soluble. Growth hormone is a peptide, and it is also water soluble. A polypeptide that is also water soluble that is produced in the anterior pituitary is the adrenocorticotropic hormone, ACTH. It's a tropic hormone that promotes and maintains normal growth and development of the adrenal cortex. Androgens are hormones such as testosterone that produce secondary male characteristics. Stress, mild to moderate fevers, and hypoglycemia can increase the amount of ACTH secreted. The next one that we see is FSH, also going to the testes here. This is follicle stimulating hormone, FSH. It's another tropic hormone in the female that stimulates the growth and maturation of ovarian follicles, which contain eggs. FSH also stimulates the secretion of estrogen, and in the male, it stimulates sperm production. FSH, follicle stimulating hormone, is a glycoprotein that is water soluble. Luteinizing hormone, LH, the last one in the anterior pituitary, is a tropic hormone that causes ovulation, which is the release of the mature egg in women, and stimulates progesterone production in the ovaries. In men, luteinizing hormone stimulates the production and secretion of testosterone in the testes. LH is a glycoprotein that is water soluble. Although unclear by your diagram, prolactin, PRL, going to the breast glandular tissue, is also considered to be in the anterior pituitary in terms of secretion. And this is also a water-soluble peptide. Now, prolactin is found in both men and women, but it primarily works in two areas of a woman's body. In combination with other hormones, it plays a part in breast development. And secondly, it initiates milk production when stimulated by the central nervous system. Receptors for prolactin in lymphocytes suggest that prolactin is also involved in immune function, but we are currently unaware of the extent of that. The last hormone associated with the anterior pituitary is the melanocyte stimulating hormone. This is a water-soluble polypeptide. Melanocyte stimulating hormone acts on the pigment cells in the skin and in the adrenal glands. The exact function is uncertain, although other hormones that darken the skin control the pigmentation of the normal skin. If you have a pathology of this, you might see something occur like vitiligo, where you have patches of lighter colored skin. Now, in the posterior pituitary hormones, we have oxytocin. It is the touch hormone, what we often call the love hormone. It is involved in uterine contraction and lactation. It is a water-soluble polypeptide. It stimulates smooth muscle contraction in general, but most especially in the uterus. It's released in large quantities just before a woman gives birth, and this is part of a positive feedback cycle, which ends when the child is born. Now remember, a negative feedback cycle, we're bringing it up and then we're bringing it back to homeostasis. In a positive feedback cycle, it just keeps going and going and going and going and going and going until something stops it. A fever will keep continuing in a positive feedback cycle until there is enough bacteria that have been killed off due to the increase in temperature. In this particular case, oxytocin will keep increasing until that child is born. Oxytocin also stimulates milk letdown response, which means it causes the breast ducts to contract and actually release milk. It's also responsible for bonding behavior or feelings of belonging to one another that occurs between a parent and a child, and also in personal relationships. It is found in men and non-pregnant women as well. And this supports pair bonding in couples and enhances parental behavior towards children. It works well with several other neurotransmitters to help foster interpersonal relationships and your ability to withstand stress, empathy, and enduring loneliness. Massage, which is touch, increases oxytocin and reduces ACTH. Trust and touch are essential parts of sustaining social ties. Oxytocin reduces the stress response and supports the immune system, and it may be the mechanism through which social relationships protect health. There are a lot of studies that show the average amount of seconds to have a sustained hug to start stimulating oxytocin is 20 seconds. The last hormone here on our list is antidiuretic hormone. This is a vasopressin, antidiuretic hormone, ADH. Stimulates the kidneys to remove water from urine and release it into the bloodstream. It's stimulated by pain, anxiety, nicotine, tranquilizers, and low blood pressure. Release of ADH is inhibited by alcohol, so the amount of urine produced increases. Because ADH can cause arterioles to contract, it increases blood pressure, which is beneficial during hemorrhaging because of the rerouting of blood to the internal organs. ADH can reduce the rate of perspiration, which helps someone who is dehydrated. It helps you retain that fluid in your body. All right, where are our endocrine glands? What do they look like? Where are they located in the body? In the upper left-hand side of this image, you see the pituitary gland, which we have discussed. And next to it on the right, the little bow tie gentleman there is the thyroid gland. The thyroid gland lies on the trachea below the thyroid cartilage, and it has a right and left lobe connected by a bridge, giving it a little butterfly or bow tie shape. Now remember, the thyroid gland regulates metabolism in the body. It also regulates calcium reabsorption in the bone. Now the parathyroid glands are these little pea-shaped, there's 4 of them, little pea-sized bodies that are located on the posterior surface of the thyroid lobes. And their hormone, parathormone, which is combined with vitamin D, reduces the amount of calcium excreted, resulting in an increase in blood levels of calcium and phosphorus, whereas your thyroid gland decreases the amount of calcium in the blood. So right here with the thyroid and the parathyroid work in concert as a negative feedback loop. All right. Our next bad boy here in the book is the pancreas. It is a long, slender gland. It's located behind the stomach. It is both an exocrine and an endocrine gland. It does release insulin when levels of blood sugar, amino acids, and fatty acids rise. We have 2 adrenal glands, one on top of each of our kidneys. Each gland consists of an inner portion called the medulla and an outer layer called the adrenal cortex. The male and female gonads, the testes, and the ovaries are located in the pelvic cavity. These produce sex hormones identical to those of the adrenal cortex. That's right, gonadocorticoids are actually produced in the adrenal glands. They produce male and female sex steroids just like the testes and ovaries do. There is detailed information about this on page 193 in your textbook. The pineal gland is a tiny gland inside of the brain within the diencephalon, and it's surrounded by pia mater. All of the functions of this gland have not been identified yet. Serotonin, norepinephrine, dopamine, histamine, and other neurotransmitters and hormones have been identified from this gland, but its major function seems to be to secrete melatonin. Now remember, melatonin is all about your circadian rhythm. This gland is light sensitive, and it's involved with regulating the rhythmic patterns of the body. The pineal gland also produces a hormone that stimulates the secretion of aldosterone by the adrenal cortex. So many body rhythms have long been known to move in step with one another or to be entrained. Remember that word? The body temperature, our pulse, hormone concentrations, and sleep-wake cycles seem to follow the same beat over and over again in a 24-hour period. Think back to when we were talking about biorhythms. The influences of light on the biological clock of the hypothalamus activate most of these body rhythms. Melatonin secretion is inhibited when light reaches the eyes and is enhanced during darkness. Many ancient healing rituals are timed with the rising and the setting of the sun, and we now understand how sunlight affects body rhythm. Vitamin D, which is produced by our body when skin is exposed to sunlight, is also classified as a hormone because it's important in the regulation of calcium levels, bone health, immune function, and so much more. If you want to know more information about hormones and biorhythms, please let me know and I can look up some more information. This is another one of those topics that is absolutely fascinating, but I will not wax poetic on it and bore you because it is not in detail on your MBLEX. However, if you are interested, please let me know and I will give you more information on it. Our next gland is the thymus. It is a gland located deep to the sternum, and it is between the lungs at the level of the 4th and 5th thoracic vertebrae. It's part of the lymphatic system and is identified as the master gland of the immune system. It does have endocrine secretions. Secretions. We keep saying this. Well, one of the major pathologies of the endocrine system is hypersecretion, too much secretion. And there are multiple mechanisms that could be responsible for hyper or excessive secretion. Tumors can be responsible for proliferation or metastasized endocrine cells, and that increases the amount of tissue that's available, which means it increases the hormone secretion. Another cause of hypersecretion is autoimmunity resulting from abnormal functioning of the immune system. And also hypersecretion can be from a failure of the feedback mechanisms that regulate secretion of the hormone. So if your parathyroids aren't working correctly, which will increase the level of calcium in your blood, and your thyroid is just going crazy with it, you could eventually have all of your calcium leached out of your bloodstream. The other major cause of pathologies in the endocrine system is hyposecretion. So if hypersecretion is excessive secretion, obviously, hyposecretion is not enough, is coming out. Tissue death, blockages, failure of blood supplies can all cause a gland to reduce its hormonal output. Abnormalities of the immune function can cause hyper or hyposecretion. An autoimmune attack on glandular tissue has the effect of reducing hormone output. And recent studies have shown that many types of hyposecretion disorders are actually caused by an insensitivity of the target cells rather than actual hyposecretion. So the hormone is secreting in this event, but it's not actually able to latch on or connect to that target cell. All right, in this image from your book, we see some of the effects of hyper and hypothyroidism specifically. So with hypofunction or undersecretion, we can see loss of hair or the hair becoming coarse and brittle. We will see edema, periorbital edema. So you'll see those puffy swelling underneath the eyes. Additionally, you'll see a puffy face. You see how the jowls look like they're sticking out and a little bit haggard. This comes with a normal-sized or small thyroid. You can have heart failure, bradycardia, lower heartbeat, constipation, peristalsis slows down, there's improper water absorption, and you get impactions in your bowels. You also have cold intolerance, where you feel incredibly cold a lot of the time. You get muscle weakness, and you get edema or swelling of the extremities. You see this enlargement and intolerance to your external environment with this. Now with hyperfunction, your hair begins to thin. Your eyes begin to protrude, especially if you end up getting Graves' disease. You'll often have an enlarged thyroid, and it'll feel warm on palpation, meaning when someone palpates it, you will feel the heat coming from it. You will see a toxic nodule on there. You will also see swelling at the neck. Very often people get large goiters. You can have heart failure as well. This time with tachycardia, your heartbeat will be significantly increased. You will have diarrhea. You can have warm skin with sweaty palms. And hyperflexia, you can actually have an increased amount of reactions to bodily reflexes like twitching, spastic tendencies. It's not an increase in flexibility. It is an overreaction of both involuntary and voluntary reflexes. In the case of the overreaction of the involuntary or autonomic nervous system to stimulation, could include that change in heart rate, excessive sweating, and high blood pressure. All right, our other big boy that we are concerned about, aside from the thyroid as a massage therapist and the potential signs and symptoms of hypo or hypersecretion of an endocrine organ, would be the pancreas. Now, if we have hyperfunction of the pancreas, usually a tumor is causing high insulin levels. This is called an insulin reaction, and this is when the body is just flooded with insulin. Glucose enters your body cells at an increased rate, and then the blood glucose rapidly falls, causing what we call hypoglycemia or low blood sugar. And when the brain is deprived of glucose, which is its food source, confusion and weakness result. A deficient production of glucagon may cause hypoglycemia. Actual true hypoglycemia is super duper rare, but what is really common and what you will probably see at some point in your office is maybe a sweaty, shaky client. They're having reactive hypoglycemia, which is a diet-induced condition, which can easily be corrected by eating a balanced diet on a regular schedule or having a snack with a little bit of sugar in it. Now, hypofunction of the pancreas causes diabetes. This is from the pancreas not producing enough insulin or completely stopping insulin production. Because body cells do not absorb glucose directly, the amount in the bloodstream increases significantly. This is hyperglycemia. And since glucose is a powerful diuretic, when it enters the urine, it's also accompanied by a ton of water. So you are peeing and peeing and peeing. Fun fact, diabetic pee also tastes sweet and smells sweet. So when your body is unable to use the glucose as it's meant to, along with the insulin, it starts to use fat for energy. The breakdown of fat results in the formation of ketones, keto acids as byproducts. But this increases body acidity and can cause ketoacidosis. Sometimes the combination of dehydration, high blood sugar, and acidosis depresses the cerebral cortex to the point of actually causing a coma. Additional complications of diabetes that you need to watch out for. High glucose levels in the body raise chances of infection. Sugar is an excellent medium for bacterial growth. There's kidney disease, which is highly prevalent. Heart attacks. People with diabetes have twice the average rate of heart attacks. Eye problems, diabetic retinopathy, glaucoma, cataracts. There could be impotence in men, loss of menstrual cycles in women. Gangrene of the feet actually accounts for more amputations of the feet than any other condition, including trauma. So this is something that you need to really watch out for. Peripheral nerve damage is pretty severe with type 1 diabetes, especially those who have had ketoacidosis. They can have reduced feeling in their feet, which might cause potential issues if you're working on painful or infected tissue, but your client cannot tell you because they cannot actually feel it. There are several instances of foot rot leading to gangrene and body parts falling off in a diabetic, unless they're actually checking their feet for health, will never notice. The last little thing that I want to interject is pineal pathology. And there's two major things. One, living in Michigan, we do have some people that are affected by SAD, seasonal affective disorder. And this can cause mood swings that are grossly exaggerated. As the days grow shorter and fall, people with SAD become irritable, anxious, sleepy, and socially withdrawn. Their appetite becomes insatiable, and they crave carbohydrates and gain weight readily. And this is because of a lack of sunlight exposure and vitamin D production. The symptoms of SAD are virtually identical to those seen in individuals with carbohydrate craving obesity and premenstrual symptoms. So another cool thing to mention, especially since some of you are working overnight, night workers, a good portion of my life was also doing the night shift. There's nothing quite like it. But night shift workers show a reversed melatonin secretion pattern. All right, so remember, when the pineal gland is exposed to light during the night, it releases no hormone. It needs dark to create melatonin. Okay, so it doesn't release anything at night when you're in the light of the store, stocking it, or whatever you're doing for work. And then when you're during the daytime sleeping hours and you manage to go to sleep and melatonin's being produced, if you wake up and then you're exposed to bright light in the middle of the day, your melatonin levels instantly drop. And the same sort of melatonin inversion occurs in people who fly from coast to coast when we talk about jet lag. These types of reversals disrupt sleep patterns. Your biological patterns, your circadian rhythm is thrown completely off. And just to say again, not just in hormone production, but in nearly every function of your body, anything that disrupts sleep eventually causes widespread stress in the body. I absolutely cannot tell you this enough. Getting the appropriate amount of sleep is one of the healthiest things that you can do for your body. All right. In terms of therapeutic massage, relaxation methods, including therapeutic massage, can support effective sleep patterns. Adhering to a bedtime and wake time schedule can reestablish sleep patterns, and sleeping in as much darkness as possible and experiencing enough natural light during the day seem to be exceptionally important. Engaging in moderate exercise during the day and a gentle stretching program before going to bed is also beneficial. Eating on a regular schedule can also reinforce your biorhythms. Now, please check out your PowerPoint. Again, anything that your book deems an important cliff note will be in that PowerPoint. And just look to your videos and assignments for any extra information. Please remember to do your ABMPs. Those questions on the endocrine system will be most similar to those on your MBLEX. Have an excellent week.